Awesome. Thank you all for being here. This is our March edition of Community Connections Night. We hope that you find a lot of great information. This program is put together by UndocuHUB. UndocuHUB is a joint program between the Colorado Immigrant Rights Coalition, Metro State University Immigrant Services Program, and Denver Children's Advocacy Center. The three organizations came together to form UndocuHUB, a place for resources for the undocumented and documented community of Colorado. We have a website called undocuhelp.com where you can find resources available to anybody regardless of immigration status, and you can connect with all the service providers who provide those services. We're always in search of more service providers to our resource database. So if you know of any resources for the immigrant community, you can send them my way. I will put my email on the chat, and you can connect me with those folks so that I can get them added to our resource website. And I will also put in the chat the URL for our website. Today, we will have a few organizations talking about reproductive justice and what does that mean for the immigrant community and especially for people here in Colorado. And so, but before that, we have an announcement from young women from Sigma Lambda Gamma at Metro State University. So if I can have you all share here.
Thank you so much, Juan, for having us today. Hello, everyone. My name is Mariana Pascual. I am a student here at MSU Denver and a member of Sigma Lambda Gamma National Sorority. Our sorority very much values community service and values cultural awareness. A lot of us are women of color who come from immigrant parents or immigrants themselves. I'm an immigrant, I'm a DACA recipient, first gen, so it's been pretty difficult to navigate spaces like higher ed. And so I'm sure a lot of people in our community also share that same experience. So we wanted to create an event where we can kind of have an open conversation about what it means to be an immigrant navigating these spaces. So we have put together an event called Navigating Professional Environments and Immigration Policy. So during this event, we will have two panelists, Estefany Peña, which I'm sure all of you all know who she is. She's done amazing work in the immigrant community. She was a MSU Denver alumni and now works in the Immigrant Services Program here in Denver. And then we'll also have Ray Rodriguez. He also worked with CIRC very heavily, and he is a CU Denver alumni. Both have navigated these spaces of higher ed, so we will have them share their story, share how they navigated this space and how they're now contributing back to these spaces, to our immigrant community. So this event will be taking place on April 6th. From 6:30 to 7:30. This will be a hybrid option, meaning that you can come in person to MSU Denver and join the conversation, or you can join virtually. We will send Juan all the details so he can share that with you all. But yeah, we're super excited to see everyone there, especially parents that want to share this type of information with their children that want to pursue higher ed. And just immigrants in general, because I know imposter syndrome can be a huge thing. So we're super excited to see you all there. Thank you so much for inviting us to this space. And then one of the other members of Sigma Lambda Gamma also has another thing that they want to share with you all.
Thank you so much, sister. Hi, everyone. My name is Valeria Quiroz, and as Mariana, I'm also a student at MSU Denver and member of Sigma Lambda Gamma National Sorority. And like my sister said, immigration advocacy and community service, cultural awareness, those are values that are very close to us. Along with this event, I also want to let you all know about this fundraiser that we've been having. We started it last year, I believe. If not last year, maybe 2020, I don't remember because we had to stop it for a while. But it is this fundraise to, we fundraise money to help the DACA students to renew their DACA through Bonfire, which is a website. So we sell hoodies with a specific design that one of our sisters did. Maybe you're familiar with the fundraiser that we did a few years ago. Since it was very successful and like a lot of people, at least in our community on campus, was able to purchase and help the community. All the funds go to ISP, which is the Immigrant Services Program here at MSU Denver, and they are the ones in charge of like delegating the funds to DACA students who need to help them renew their DACA. We'll share the link of the Bonfire website as well as the flyer if you want to pass it along in a few minutes here, because I'm on my phone, so my apologies. I need to like send it into the chat. And yeah, that will be very helpful. We really, like my sister said, we really hold this cause close to us. I myself am also an immigrant, first generation. So yeah, thank you so much for having us.
Thank you both for those announcements. And now we'll have Color take it away for tonight's training.
Hi, everybody. My name is Catherine, and I am the Policy Director for Color, the Colorado Organization for Latina Opportunity and Reproductive Rights. I want to thank UndocuHUB for having us here tonight. We're really excited to share with you some services and a bill that we passed last year, and hopefully it will be beneficial to you all and friends and family. So briefly though, before we get started, I want to give a little like lesson 101 on what is reproductive justice. Since Color is a reproductive justice organization in Colorado, we are Latina led and Latina serving. So we work to enable other Latinos in the state to lead safe, healthy, and self-determined lives. And reproductive justice is how we do that. So reproductive justice, a brief history, came from like the white feminist movement, when the feminist movement was starting back in like what, the 50s or so. And white feminists were calling for certain things, and a lot of Black and brown folks were saying like, yes, we want all of those things, but we also want all of this other stuff. It wasn't meeting their needs. And so it really came about from Black and brown activists, particularly Black activists in the South, in Atlanta and Georgia. And reproductive justice is made up of 4 different like tenets. The first one is the right to have kids. The second is the right not to have kids. The third is the right to raise those children in safe and healthy environments. And the last tenet is the right to personal bodily autonomy and self-determination. So what that means is that rather than working just on reproductive rights, like a lot of you probably know who Planned Parenthood is and some of these other big reproductive rights organizations, reproductive justice really works at the intersection of all of the other social justice issues that our communities live within and experience. So like the right to raise your children in safe and healthy environments could include environmental justice or immigrant rights or labor rights so that you're making a living wage and can care for your family, or food justice so that everyone in your family is able to access food and healthy food. And so we really work, Color works at the intersection of all these different issues and areas. And so that's really what makes reproductive justice different than just reproductive health or just reproductive rights. And we call it's RJ if you're using like the acronym to make it shorter. So a lot of the other RJ orgs that you'll see around the country are led by people of color. That's like one of the main things about RJ is that it's a person of color led movement. And so some of the other things around like personal bodily autonomy and self-determination include like LGBTQ plus liberation, being able to make our own decisions, not having somebody else make our decisions about our bodies or our families and things like that. So that's really like a very brief background of the work that we do. So I want to share with you about a bill that we passed last year. It was called Senate Bill 9, and the bill does two things. What it does is that it allows anyone who would qualify for Medicaid, if it were not for their immigration status, to access contraceptives through state Medicaid. So as we know, undocumented folks can't access state Medicaid here in Colorado just yet. Raquel will be talking about that maybe later, and fingers crossed that will happen soon. But we know that that is not allowed right now in Colorado. So what SB 9 did was it allows folks to access just contraceptives and contraceptive counseling through state Medicaid. One of the reasons that we chose to bring this bill forward is because we tried previously the year before to bring like a really big bill that would have included a lot of other reproductive health services like prenatal care and postpartum care and fertility services and breast cancer treatment and things like that. And we couldn't get the bill passed. It was too big and it was too expensive. And so then we had the pandemic. And so we had another year where we couldn't like bring another big bill. And so finally, last year, we decided to just pick like the one thing that we knew would have a really big impact. And so we chose to focus on contraceptives. We know that when people have access to contraceptives, they're able to realize their own reproductive goals. And then when you reach your own reproductive goals, you can then achieve like your educational, employment, and financial ambitions. And so we felt that this was really important for folks to be able to realize like their own dreams, really. We also have a lot of data around contraceptive services and information. So we know that only half of immigrant women receive contraceptive services or information compared to 2/3 of women born in the US. And then we know that in Colorado in particular, more than 300,000 people are in need of publicly funded contraception, and 10,000 live in an area that doesn't even have one single health center that offers all of the contraceptive methods. So we felt like this was a really big deal that would have a really big impact, and the bill passed. And so that means that anyone who is undocumented can now enroll in Colorado's state Medicaid program starting on July 1st, and you'll be able to access the full range of birth control methods and counseling. And then the second piece of this bill is for everybody who is on Medicaid, not just immigrants. But it allows people to access a full year of oral contraceptives, so like birth control pills, at one time. We know that now when you go, you get like 1 month at a time. Maybe if you're lucky, you get 3 months at a time. But there's a lot of data coming out of the CDC and other places that show that really having access to that year supply at one time really makes a difference and helps folks stay on whatever birth control it is that they choose to be on. So this program will start on July 1st. You'll be able to enroll on the Health First Colorado website. They are telling us that you should be able to enroll in like one day, and then you'll find out that day if you qualify. So you don't even need to enroll like way in advance. You can just enroll on the day that it opens. One of the biggest pieces about this bill is that we want to make sure that people all over the state know about it. We know that in the Denver metro area, it's a lot easier for folks to access services we have a lot of clinics around here and a lot of providers, but we know that in the rural and mountain areas, it's a lot harder. So if this seems like something that would benefit friends or family, please share that, because we're gonna get, like the way the program goes the first year is gonna help Medicaid in the next year. So if it goes really well in year one, we'll get like more money and the program can continue on running. And so we really want to make sure that this first year goes really well. I have a couple just like little one pagers about the bill that I'll just drop in the chat, one in English and one in Spanish. But that's really the exciting news we wanted to share with you about Senate Bill 9, is that it will start July 1st. Everyone who qualifies will be able to access the services that I mentioned. And then the cool thing about this bill is that it set up the technology that Medicaid in Colorado needs to add other services and other groups of immigrant communities to continue adding services for these communities. And so I think Raquel will be speaking more about that a bit later, but it really like laid the foundation and set the groundwork for us in Colorado to keep building upon this and getting more access and healthcare coverage to the communities we know that need it the most. So with that, I will pass it over to my colleague America, and then I think we'll do questions at the very end. So if anyone has questions, oh, my cats are fighting. If anyone has questions about this, you can ask me at the end. Thank you.
Thanks, Catherine. Yeah, so all of the work that happened with SB 9 and with the work that we're going to continue to talk about really is rooted in the community. And, you know, we know that our work would really have no meaning without community input, community support, and community contribution. And so at Color, we also have, you know, programs that are rooted in getting people involved and being able to take space and kind of find their seat at the table, right? Because at Color, we have a lot of work that we do within organizing, leadership development, and like political advocacy, which you just heard a little bit about. And so we're always looking for folks to also sign up and contribute to some of that, right? Whether it's part of the policy work that we do and engaging in passing more bills that become laws. We also have organizing work that we do throughout the year, including the election cycles. And then for the program aspects that we have running different times of the year that I help support include youth leadership programming. We have a program called LIPS, which is Latinas Increasing Political Strength, that happens every spring for a span of 10 weeks, where we invite 16 to 21-year-olds to participate in the program. And so it's a leadership political advocacy program where we learn about how a bill becomes a law and how the process of like SB 9 came to be, what the implications are and how to be involved, and how to really kind of become your own, become a leader in your own community, which is really important because we know that without community leaders, a lot of the work that we do would not be able to be accomplished. And so we like to, you know, be able to provide some of that knowledge for our young people. We also have different programming around comprehensive sex education that we provide all across the state. We also have a fellowship program called the Youth of Color Fellowship, where we hire 3 fellows. And so it's actually a paid fellowship program in the, I guess, in the areas of organizing, communications, and policy. And so it's kind of like a step up to our leadership program, where you start to apply a lot of that knowledge and are able to get on that hands-on experience of how our policy work is engaged with, how our organizing work is planned out and supported, and how we develop our communications as well to get the word out to community about certain things or about different issues that are going on. We also have a radio program that we have every Tuesday morning. We stream it on our Facebook, but it is also on, I think it's 11:50 a.m. on the radio. That's the station number, I should say, 11:50 a.m. But the radio show starts at 9 o'clock a.m. every Tuesday morning. And so you can always get involved in those ways. And then I'll add all of our social media contact information in the chat. And if you're ever interested in participating in any of those things, bringing these kinds of trainings, like what Catherine was talking about reproductive justice, but kind of getting into more depth, talking about intersectionality, the different forms of oppression, and you're just interested in learning more with some of the clubs or the groups that you're in, we are more than happy to bring that to wherever you're at. So yeah, that's pretty much the gist of what we've got. Like I said, if you have any questions or you want to reach out to us directly, you can email us at info@colorlatina.org, which I'll also put in the chat. And I will go ahead and pass it to Raquel.
Thanks, America. Hey, y'all. Thanks so much for joining us tonight. My name is Raquel Nariano, and I'm the policy manager with the Colorado Immigrant Rights Coalition. And I want to thank UndocuHUB and Color for inviting us to be in this space. I'm going to be talking a little bit about a really exciting campaign that we're working on this year to expand healthcare access for our undocumented community. We also get to work on this campaign with Color and a lot of other incredible organizations. But I want to start first by saying like how CIRC got to focus on this, because I think it's important too for context. So for those of you that might not be as familiar with the coalition, the Colorado Immigrant Rights Coalition is a statewide coalition with member organizations all across Colorado that started in 2002 at a time when there was a lot of anti-immigrant sentiment, especially after 9/11. And for the beginning years of the coalition, like we were really focused on defense, right? On protecting our communities from deportation and trying to keep police from collaborating with ICE. And that's still certainly a problem that we're seeing. But we've come such a long way, right? In 2006, there were bills passed in our state that were, very anti-immigrant. There was a Show Me Your Papers bill passed in 2006 that basically required law enforcement to ask folks about their immigration status when they did a routine traffic stop. And us as a coalition, every year, our members across the state vote and decide what they want us to focus on. And for the longest time, the focus has always been on trying to limit deportations, right? Trying to make sure that our communities can stay here and stay whole. And what we've seen, though, I think with the progress that we've been able to make, organizations like Color, who keep breaking down huge barriers that our communities are facing, right, one after the other, I think what we've seen with that progress is it's allowing our members here at CIRC to start focusing on things like health, right? Things that are like more than just surviving. It's about like also surviving and thriving, right? So this year, our members voted in every single region in the state, had overwhelming support for us to focus on mental health and also to focus on expanding access to health resources for our undocumented community. And so just want to share that context because I think there's so much energy around this campaign and this movement. And I mean, huge shout out to like Center for Health Progress and Color and all the organizations that have been focused on the health access, right? And expanding these resources, even when moments when it seemed like a 10-year battle, right? And yeah, we're still like, we're right in the middle of it, but we're at a really exciting moment where hopefully we're about to break down our really big door. And before I jump into what this bill will do, like I'll share a little bit of some of the barriers that our communities face, although I don't think it's going to be news to anyone in this space. We know that a lot of our undocumented community members, right, are almost entirely locked out of getting access to health insurance. Undocumented folks really can't buy on the private insurance market. There's also bars on getting access to Medicaid or other low cost or no cost insurance. And so oftentimes our undocumented community members end up, only being able to access care, whether it's at a community clinic or through emergency Medicaid. And what that means is that people are not going to the doctor, when they feel sick, when they feel nervous, until it feels like an emergency, because that's the only time that they'll be treated without having to take home extreme costs. And even in some of those situations, right, it can be really scary because you might show up and not know whether or not it'll qualify, right? And folks are still really rightfully scared about potentially facing really large bills. We also know that the last administration, the Trump administration, was really intentional about trying to ice out our communities from these resources. And they instilled a public charge rule, right, that was harsher than anything we've ever seen in any of the previous public charge rules. And that has since been taken down, right? That public charge rule is no longer to the same degree as it was at all. But that had a tremendous impact on how our communities think about whether or not they're going to go to the doctor, right? Because people are afraid of future immigration consequences. And what we see too is that means if you have a mixed status family, that those parents or folks who are in the decision-making seat are less likely to take family members who might even qualify, right, for Medicaid or for other services, less likely to take those folks in because they're still afraid of that public charge, right? And the impact that has on our communities, it's unspeakable, right? It's people choosing to forego care. It's also parents being unable to give their kids everything that their kids deserve or that they themselves deserve, right? Everyone deserves to have that care, regardless of their immigration status, right? That shouldn't be a determining factor on whether or not you get to go see the doctor when you're in an emergency situation, or when you are just hoping to, find out what's going on in your body and check in and check up on yourself. We know that because of the insurance rates for our community, especially for our undocumented community, we see higher infant mortality rates, right? Higher mortality rates for birthing parents. The amount of medical debt, right, has mental health impacts. If somebody knows that they are ill and knows they need a treatment and cannot afford it, right, because of how much it costs, like that is going to wear on you every single day, right? That's never going to be something that you're not thinking about, and that's not, deteriorating your mental health and your well-being. And we also know that is, not having insurance and the public charge effect and these intentional barriers against our community are big reasons why COVID hit immigrants hardest, right? The big reasons why COVID hit communities of color really, really incredibly hard, right? Because when people have fear for getting resources they need, when they don't know how much a treatment is going to cost, all of that amounts to folks making decisions not to go seek the care that they deserve. So I share that context. I think there's a really exciting solution that we're working on with many incredible organizations. We introduced a bill this year. It's House Bill 1289, and I'll drop some resources in the chat. But this bill is being guided by directly impacted folks all across the state. So we have directly impacted people who are helping us sit on the steering committee that guides the direction of this bill, that helps decide, what the bill will look like. And a few big aspects of the bill is that, one, it will expand access to Medicaid and to CHIP, which is the Colorado Health Program for low-income children and pregnant people. And that's huge. That's the big door that we're trying to break down, right? Because like Catherine said, when you open up that, when you create the program, then you can build on it, right? So right now, expanding to children and pregnant people, that's opening one of the biggest doors, because that allows us to come back for adults, for our elders, so that we can make sure that our entire community can get access to Medicaid and CHIP, regardless of their immigration status, and so that they can get that care that they deserve, right? The other thing that our bill does, which is really exciting, is it increases access to resources for pregnant people, right? One of the biggest ones that we're hoping to increase access to is breast pumps, and making sure that, you know, folks have access to really high quality breast pumps, a double electric pump, so that, you know, folks can still have the opportunity, right, to give their children breast milk, even if they have to work, right? If they don't have the luxury of not working after giving birth. Another really exciting thing our bill does is it creates a special enrollment period for pregnancy. So currently, if you're going to enroll for health insurance, there's a window every year when you're allowed to enroll. But if you're outside that window, you can't enroll, right? And so this basically makes becoming pregnant a qualifying life event, a life-changing event. Like something has happened in your life where you can now enroll in insurance the moment that happens, right? The moment that you can verify that happens. So that's going to be exciting. That applies to any person. So not just undocumented Coloradans, but that would apply to every person in Colorado. And then the last part of our bill that is also incredibly important is there's a survey that exists, right, for birthing parents in Colorado. And what we want to do is make sure that survey oversamples BIPOC communities. Specifically, we want to make sure we're oversampling Black and Indigenous folks when they give birth in Colorado, because that data allows us to go back and see, right, where are folks experiencing racism in their birthing process. Because when folks aren't heard by their doctors, when folks feel or have experiences that don't meet their needs, that translates really quickly into bad outcomes for parents, for families, and for children, right? So we're also hoping to make sure that we expand and make sure that survey is really capturing the experiences that Black and Indigenous folks are going through when they go through, having a birth or birthing a child here in Colorado. So I'll stop there in terms of what the bill does, but we just passed out of our first committee on Friday, and we're headed to appropriations. And once we pass out of there, we'll head to the Senate. We could definitely use your support on this bill. Apologize for the background noise. I'm going to drop some links in the chat, but if you'd like to sign on as an individual, if you're a part of an organization, you can also sign on in that capacity. And I'll also drop my email in case you want to get involved, because we'd love to have support from folks. So I will pass it back to Juan, I think, but please feel free to ask questions at the end as well.
Thank you, Raquel, and thank you all the women from Color who presented today. We will open it up for questions on all the information that was presented. So if you have any questions, feel free to raise your hand. And then for our presenters, if you know the answer, feel free to just take the question. So I don't see anybody asking questions, so I'm gonna start by asking one. Where in the process is the bill that you talked about, Raquel, and what is next, or when can we next affect change in regards to that bill?
Yeah, I wish I had a diagram I could just show, but our bill is at the very beginning. It's in the House, and it has to go through the House, and then it has to go to the Senate, and then to the governor's office. So we have just passed through our first committee in the House. We have one more committee, then they'll debate it in the House, and then we do all of that again in the Senate. The next big opportunity for folks to get engaged is going to be when we go to the Senate to our first committee. We're really going to need to hear stories from folks, right? So if you have a story of someone who would be impacted by this bill, that would be really helpful. Or if you have a story of someone who's just impacted by not having insurance, who maybe isn't impacted by this bill, but would be impacted, by a future bill that would open access to them as well. Those kind of stories are really important to tell. And if you have those kind of stories and you'd like to share, I put my email in the chat. That's probably going to be, one of the best ways to let us know if you're trying to get involved in that way. But thank you, Juan. That's an excellent question.
Awesome. Thank you, Raquel. Do we have any other questions? Okay, so it seems like we were very thorough on our information. Thank you to all of our presenters. We will end our programming early so that we can get back to our evenings. Thank you all so much for being here. Thank you to Raquel from CIRC. Thank you to Catherine from Color, and thank you to America from Color. Thank you to the young women from Sigma Lambda Gamma who remember are doing an amazing fundraiser for DACA recipients, and also are having an event where they will be discussing important information. Please do join them. Thank you all for joining us. Once again, every last Tuesday of the month, we have Community Connections Nights, in which we talk about different topics that affect the immigrant communities here in Colorado. Super happy to provide this space for any organization who has important information for the immigrant community, especially if it affects everybody regardless of immigration status. Please do reach out to me if you have a topic that you would like to cover in our next Community Connection Night. And we'll see you all in April at the end of the month on the last Tuesday at 6 p.m. Thank you all.